Welcome to Pastor G's Roundtable. Thank you so much for joining us on another episode on Biofeedback. This time together with Andrea Venter, who is our health coach, who has been delving deep into and making us understand what biofeedback is. We are today joined by Ellen, who's going to be showing you what actually happens in the biofeedback. He will be displaying exactly on spot what's happening in his life in terms of his health, and I'm sure this is going to be exciting so that we get to understand not only what is happening but also the benefits that outside the previous episode we're talking about, which Andrea maybe must talk to as you are welcomed by our listeners and viewers.
Sure, thank you. I'm going to take you through a quick biofeedback scan so that you guys get a bit of an understanding about what we actually look for when we do scan. There are basically about 800 points on the body that you're able to scan. So we won't be scanning all of Aaron's points of his body today.
Yeah.
I've selected about 32 that we can run through, and then we're going to do a really short analysis thereafter so I can show you how it analyzes the data and provide feedback to him to improve the lifestyle that he's living at the moment.
This is real-time information. It's not fictitious information. It is real-time. It's what's exactly happening in Aaron's life right now.
So we might be a little bit nervous because whatever we're going to see here is really what's going on inside him. So there might be some confidential information, but thank you very much for sharing with us. So I've pre-selected some of the images here that I'd like to scan. We have scanned Aaron before, and there was a lot going on in the system, so we really want to see what's improved with a little bit of things that he has done so far.
Yeah.
So I've selected generally a full body view, and then I just did his heart, intestines and gallbladder. Aaron's an O blood type, so I already know that he consumes dairy, so I already know that there's going to be a problem in the heart and a problem in the gallbladder, purely because of the calcium intake.
Yeah.
And then I'm just doing his blood cells, which will give me an understanding of whether he's fighting an allergy, whether he's fighting, his immune system's working, and what bugs we are working with actually. So it's just a very mini scan. My clients usually we do about 400 or 500 things on the first scan, and then we will start going deep diving every single week or every single month, however they come through. So I don't know if you want to zoom in a little bit closer, because as we start the research, what's happening here is I'm starting to see numbers, very good changes. Okay, we know we've been doing some kidney cleansing, and the scan pops up with images of different parts of his body. We're doing sagittal parts as if we're cutting him in half at different vertebrae. And we're looking for numbers. So 5s and 6s are generally where there's some danger. As you can see, we've got quite a bit in the intestines there. And we need to figure out what's going on and why that's happening. So we see some lungs. We definitely see in the heart, we've got some 5s and 6s. So this is definitely going to give me an information as to how we can go forward in treating him to make him feel a little bit better. Some of the symptoms he's been having are some intestinal pains. He's been having rheumatic pains, so joint pains, neck pains, swelling around the thyroid or throat area, a little bit of sinus, I think there was. So those can speak to us. Those symptoms are about 5 or 6 different diseases that you could look at.
What I like is what I always see. You come for the first biofeedback data checkup, and it shows you a lot of 6s and 5s, and you get worried. But at a later stage, when you go back after you've done some coaching and change of lifestyle, immediately you see a decline in terms of those numbers to 4, 3, and subsequently you get cleared and
everything goes back into the green zone.
Goes back to the green zone.
Yeah, so we're really happy about that.
Yeah.
So what we will be able to see is where there's some changes in from our first scan to our second scan. However, that's within a week space, so he could be on a really big detox at the same time.
Yeah.
So what happens is we'll see that if the body's detoxing, I'll be like, it's okay, it's dealing with that at the moment. Let's come back a month to that without treating it, just keep detoxing. Or he could have picked something up like in the last week or two, maybe he's been outdoors and he's picked up a worm and that sort of thing that could have entered the body, and then we're going to start figuring it out. So that's the research done. And we can see that the immune system is fighting really hard because his red bone marrow, his blood cells, his neutrophil and his monocyte, these are white blood cells that fight infection, are not doing so well. So here I go into my researching. I'm going to compare it to the last scan we did, which was on the 28th of September, and see, for example, we see his lungs were in a better state to a week ago. And now it's not so great over there. So that could either be detoxing, or we'll start figuring out what was going on. So I'll go in there and see, and start analysing it. Just for example though, okay, let's get in there. Let's look at the intestine quickly, because it's right here. So there we're seeing a few 6s there, which could be worms, parasites. Let's have a look.
I'm sure there's a lot of people who do not realize this. They've got a lot of parasites and worms.
And they deworm once a year, and they go, deworm when the dogs deworm, and you're like, but you go outside, you eat salads, you're constantly exposed to worms.
I've had that experience where I thought I had dewormed.
Yes.
And when I come back, it's just now they are like resistant by leaving their eggs behind, which is not fair. These things are really, they should just go, man, one day.
Well, you know, that some of the worms are actually very good for us, because they actually help us metabolize food and clear out other bacteria. So we just want our body to not be harmed by them. And that's where the biofeedback will say, you've got them, but is it harmful or not? So is it in the red, and at what level is that at?
Very important.
So I know we previously were dealing with E. coli infection, because again, he consumes dairy and he consumes a lot of fruit as an O blood type. And in the intestine, we're out of the red there, so there's no red. So his E. coli is still up there in the intestine, but it's not red and it's not harmful.
Yeah.
If I had to go to the 28th, let's see if we still had the damage, if there were any that were harmful. Also not, but we moved up a little bit of a point. So he's starting to clear his intestines. Nothing's really damaging, even though he's got a whole bunch of 6s there. We just have to make sure that now I know there's E. coli, I know he's an O blood type, I know what would be encouraging that.
Yeah.
Further down the line, I've run a food allergen test, and it says wheat. So we also, even though it's not in the red, I can still say to him, I think the wheat that you would be eating is still damaging you.
Yeah.
And then every scan we want, if the person's eliminating wheat entirely from the diet, we'd actually be able to, you'd see the numbers move forward, or the frequencies move further and further away from 0, 0.000, and then we know the body's actually healing and self-healing itself. So at the moment his intestines are dealing with the bacteria on its own without it doing any tissue damage, for example.
I like what you said now, self-healing, because the biggest problem, we always want to ingest a lot of medication for years, which subsequently damage you. And if your body can self-heal, why not allow it to self-heal without even having to ingest anything?
And as you've been with the experience with me, is I focus a lot on food.
Yeah.
So if I find that someone would benefit from zinc or benefit from vitamin B12, they'll say, well, they're only benefiting from that because it's going to be inflammation, so let's see what caused that inflammation.
Yeah.
So rather than adding zinc to your life, let's reduce the cause of the need to have that.
Yeah.
So what we'll do now is, how I do that is I run a test.
Okay.
In this test, you've got medications that you can test. I like physical things. So as I said, there are frequency medicines that we can use, and I like to do them through the headphones rather than make the medicine in my cup.
Yeah.
I like food to make the physical effects. It also teaches people a little bit better about how to use food, what foods affect them. So right now I've got a green juice, and that green juice is apples, celery, spinach, and I think they put mint in. We bought this from a shop locally, and I just want to see if this is going to be beneficial for him. So I'm going to run a test in the intestines in a medicine cup, and then I'm going to go back to today's one.
It's exciting to see it happening.
When it helps. We're hoping it helps, because I think I've been recommending this the whole time to drink. So it's beneficial. So we'll see if there's any change. Looks amazing compared to the original scan. So there I'm going to run a test, analyze it. Okay, so the green juice would help him by 45%. So if you want to zoom in here, Tandy. And see, here we would look at, there's probably all the parasites are sitting there and they're making their way out as well through the rectum. So here, if we continue the green juice, we're looking at a 45% improvement. You see all those 5s and 6s actually move out, so very good for clearing worms. And we see some 2 frequencies coming in there, which actually means we're healing. Let me just go back to that.
Amazing.
Yeah.
And then if we decreases the nidus of defeat, which is the pathogens, by 100%. So we could likely use this, clear his E. coli, clear his parasites, and maybe in a week or 2 drink this every single day. His kidneys would also start detoxing, thyroid would start functioning, and that's, you as a health practitioner using biofeedback, you need to know that about the person's body.
Yeah.
So I wouldn't give this to maybe a B blood type because it's got spinach in it, and they do really bad on spinach, so the results would be very different.
Okay.
For example, and that's why it's very important to be so specific when you're treating people,
Yeah.
and never treating one individual like the other one.
Yeah. I know I've seen you testing some medication on people that have been on medication for over 10, 15 years, and when you test it right on spot, I've seen where you say, get off this one, get off this one, get off this one. You can't keep this one for so long, and those people have shown some improvement in their bodies. Because I'm not against medication, but I know that in most cases people tend to ingest things they are not supposed to ingest, which are reacting to their system, and your system will show that medication is reacting negatively instead of positively. So get off it. And
100%.
that's sort of what I like with real-time information that gets to be displayed in the machine.
And the one important thing to know about using biofeedback with medicine is if that machine says it's not good for them, I still need to have that understanding that you can't just take them off medicine.
Yeah.
How are you going to support this process? Because if you take someone straight off their medicine, even though it's harming them, it might be harming the liver and the toxicity of the body and changing the pathogenic behavior.
Yeah.
However, in medicine, each medicine has a messenger that will actually work for a specific organ in the body. So it's not like food, and that's where the difference is. Food helps everything, whereas medicine targets. And sometimes you need the target, depending on the state of health. So what I would likely do is say, okay, this medicine's not helping, let's find a supportive, let's start working with the dosages of the medication and start halving the dosages but finding a supportive supplement. For example, high blood pressure, I sometimes use cat's claw or magnesium citrate or magnesium glycinate to reduce people's blood pressure. But at the same time, I can't just take them completely off their medication. Also understanding what is the medication doing. Is it only blood pressure? Is it also for the kidneys? That's very important to understand that. And that's for anyone. That's not even for biofeedback specialists. For a dietitian, like a nutritionist or dietitian, they also need to have a very good knowledge of medicine, because you start feeding everybody green juice to detox, but someone's on euthyrox or thyroid medication that will send that into overdrive. And that, then you need to also, they need to manage that dosage. So sometimes your diet can create an overdose of your medication because you're healing. Does that make sense?
It does. It does. I think there was something you're talking about in terms of the emotions, the psychological side of things, which the machine also gets to give you data. Can you talk to that as we...
100%. I won't go directly into his emotions, but what I will do is explain the testing that I can do. With the emotions, obviously a lot of them are held in the intestine, in the heart, and in the mind, so I'd actually use those markers and not like a blood or a liver or that sort of thing. So in the intestines, there are so many tests. I don't know, Tanya, if you want to run through here, this topic screen. I can run all of these kinds of tests. You've got chakras, you've got medications, herbs you can use, different vitamins, different brands. You can look for brain disorders, organ disorders, amino acid deficiencies, allergies, minerals, vitamins. I mean, we've even got reptile diseases if this machine was functioned for horses, reptiles, and other animals. There are actually machines like this for animals, but we could run any of these kinds of things, and you can see I've got a stress table selection, and then I've got a behavioral selection, a bio-ME and behavior process selection. I would go into there and I would start exploring something, and if it started saying that maybe he's stressed out because of a work issue, or a father figure, or a boss, or politics is playing on his mind, or he's got a conflict with himself. Sometimes people have internal greed that they would never recognize. It's all of these things, and a lot of, for example, men that do have heart conditions that come up on the scan, you want to ask them about their emotions, because men do not speak about emotions, and it all gets held here. So I can use that biofeedback data and say, well, what about this? What about this? Do you feel that this is do you feel that this resonates with you? Are you having an issue with your aunt or your neighbor, whatever's here? And slowly we start figuring it out together. And that's like, it's so great to learn that, and I'd also love to do it for animals and with children as well. Children who can't speak and say how they feel, you could see if they're having a little bit of an issue, or peer pressure, like 14-year-olds that are going under peer pressure but they're not telling anybody about it. I scanned a 10-year-old boy the other day, and abuse came up. So I had to say to the parents, where would this come from? Is it from school? How does he feel it? What's his perception of it? Is he working with a psychiatrist? Those sorts of things, because you really need to identify these sorts of emotional cues, because I think emotions sit in your organs and they make you unhealthy.
A lot of people are sick not because of anything but upbringing, backgrounds, family history, and all of that.
And sadly, our genetics.
To pick that up, and that's very important.
A lot of the depression that we experience in society these days, you'll find that a lot of it's led to families that were in the World War and undergoing through depression, and that just passes down through family trauma. So if you actually want to heal that and break that cycle for your own children, understanding that genetics do take on those emotions and it depicts our health going forward, is very important to understand that. So we need to heal from our previous generations and not blame them for anything, if that makes sense. Because everybody goes, oh, it's their fault, but it's still your responsibility to fix it.
Ellen, thank you so much for putting your life out there. We're going to see your confidential information. And thank you, Andrea, for this informative session.
Thank you for having me.
I'm sure anyone who didn't know what we're talking about in terms of what biofeedback is, now you can see data live in action, and you've seen a display of what it can do and what it can show you and what can be recommended if you have a situation. Thank you so much, and make sure that you continue to watch and also listen to our podcast. This is Pastor G's Roundtable. We're signing out, and thank you so much. God bless.